I next wanted to just offer a personal reflection because, politicians get accused of making grand statements about things without knowing much about it, or making assertions that they don't really believe in, they don't deliver on, and so forth. But for me, mental health is more than just a professional interest, because our family has been touched by mental ill health, together, I suspect, with probably most of the families represented here in this room. Our oldest son, Archie, now 28, but at the age of 16 was diagnosed with obsessive-compulsive disorder. Now, OCD is often trivialised. You often hear people on telly talking about, oh, I'm a bit OCD-ish. The reality is that it is a painful and punishing condition where you simply cannot escape from really dark thoughts, and it ends up controlling your life. And for a teenager to go through that, it was only some time after the diagnosis that Archie revealed that for 2 or 3 years before that, he had been struggling with these thoughts without feeling able to talk about it. And the truth is that there are so many teenagers in our country who go through that situation. And I remember the moment when he said to me, why am I the only person who's going mad? And I just thought what it must be like for a teenager with all of the struggles that every teenager has to go through, trying to cope with those feelings as well. And the truth is that we as a family were let down by the NHS. We were told at one moment in Norfolk when he was about 18 or 19 that it would take 6 months to get treatment started. I was also told when I asked if we could refer him exercising choice, as the previous government in the last decade had introduced the right of choice, I asked if he could be referred to the Maudsley Hospital in London, where they had said to us that they could take him. And I was told the right of choice does not apply in mental health. Mental health had been excluded from the legal right of choice, unbelievably. And there was a funny moment because I was interviewed fairly recently by the Daily Telegraph about our experience. And I said, as an aside, the only thing that's good about our experience was that having MP after your name made absolutely no difference at all. We were treated like everyone else. This was an aside, it wasn't intended to be the headline, but that's what inevitably happened. But here's the thing, what did we do as a family at that moment of need? We paid for treatment for our son, because you do what you can for your child. But again, I can't tolerate a country where people who can afford it can get care, and those who can't afford it are left waiting or get something wholly substandard. But that is the situation in this country. And so the third thing that I wanted to address is this sense of injustice, of discrimination against people who suffer from mental ill health. And there was an intense frustration as a minister because I constantly asserted the importance of the whole system treating mental health and those who suffer from mental health equally with people who suffer from physical health problems. But here's the thing, the way the system works always discriminates against people with mental ill health. Because in the last decade, when they introduced maximum waiting time standards, in other words, the right to get treatment on time, again, they left out mental health. And I can tell you, every Monday morning in the Department of Health, Jeremy Hunt gets all the great and the good of the NHS round his table, and they focus on every hospital across the country. And they look at their performance against the 4-hour A&E standard, against the cancer waiting time standards, against the 18-week referral to treatment standard. So the whole system is focused on meeting those standards. And every CCG around the country knows that it has to try and meet those nationally set standards of access. And they are really important. But as every extra patient goes to the acute hospital, under payment by results, as it's called, paying for every bit of treatment as it goes, more and more money is sucked into acute hospitals. and something has to give. If you've got a limited budget within a CCG and you're feeding this beast of trying to meet these access standards, you have to cut something else in order to meet those standards. And you know what? It's always mental health that loses out. And here's the thing also. The economics show that if you invest £1 in early intervention in psychosis services, you get a return of £15 over a 10-year period. Reduced benefit claims, more tax paid because the person's in work, reduced use of the NHS. So why not do it? And yet the implementation of that standard has been completely flawed. And in many parts of the country, including here in Suffolk, those individuals who suffer a first episode of psychosis are not getting the full evidence-based treatment package. They've also done a really inspiring thing where they've said, we are going to end the use of face-down restraint. This is something that I feel passionately about. And the Mental Health Trust in Norfolk and Suffolk restrains far too many people, including using face-down restraint, where the person's face is put face down into the ground. This is an inhumane practice which is still used far too much across our system. But in Sheffield, they said we're going to end the use of face-down restraint and we're going to radically reduce the use of other forms of restraint, and they are doing it. So it is possible to use the money more effectively. We also need to use the money more effectively in terms of investing in children and young people. It is, in my view, again, scandalous that 0.7% of the total NHS budget is spent on children and young people's mental health. It needs to be increased significantly, and it needs to be invested in schools, early intervention, intervening quickly before there is a deterioration of health.